Alright, the first test I'm going to do is the anterior drawer. We're going to be checking for a torn ACL. I'm going to block the foot, pull in line with the shaft of the femur, checking for ligament laxity. The tibia would move anterior to the femur if the ACL was torn. Symptoms: swelling, pain, instability. You're going to see this a lot in athletes and active people. MRI is the best form of imaging to diagnose this. Active and resistive range of motion are the most affected, and there could be a possible decrease in MRS. Alright, if you flip on your stomach. Next test we're going to do is athlete's compression, checking for a torn meniscus. So I'm going to externally rotate his foot, checking the medial meniscus, apply pressure down. Any pain with that?
Nope.
And I'll do the opposite to check the lateral meniscus. Any pain with that?
Nope.
Okay, the patient's going to present with clicking, swelling, locking of the knee, caused by a rotational injury. Also very common in athletes or just anyone that is active. The meniscus acts as a shock absorber for the knee. Compression pushes down and it's not able to fully absorb it, and that is the pain is caused. Diagnosed by MRI. Active range of motion is most affected, and there's a possible decrease in MRS. Now if you want to sit up, Ryan, face this way. Next test we're going to do is Dauber's for subacromial bursitis. So I'm just going to find the bursa, compress, and then I'm going to passively abduct his arm. If he had bursitis, there would be pain when I first palpated, and that pain would go away as the muscle came up and blocked my compression, protecting the bursa. Symptoms are localized pain, and it's a constant pain, works with activity. The demographic is all ages, normally due to overuse and trauma. The bursa lubricates the movement between the humerus and the acromion. The inflamed bursa gets compressed by the surrounding musculature, causing pain. X-ray is the imaging needed just to rule out a fracture, and then all range of motion is painful. The pain is going to limit the range of motion, and there's most likely not going to be a change in MRS. Last test we're going to do is Finkelstein's. So Ryan, I'm just going to have you grip your thumb like this, and then tilt your wrist down or ulnar deviate. And is there any pain with that?
Yes.
Okay, well, that is going to indicate de Quervain's disease, and that's tendinosynovitis of those tendons right there in your thumb. So you should probably get that checked out.
Will do.
Symptoms are going to be radial wrist pain. The demographic is all ages, usually with repetitive gripping and thumb movement. A construction worker is a good example of that, holding tools, hammers, screwdrivers all day. De Quervain's tendinosynovitis, like I said, is what this is checking for. It's caused by microtrauma and overuse and inflammation of the APL and EPB tendons. Resisted thumb extension will be painful, no imaging is needed, and there'll be no change in MRS.